The title for this narrated PowerPoint may seem very strange to you: Using Personal Protective Equipment in a Hospital. One of my responsibilities as your professor is to equip you so that you will be safe when providing pastoral ministry in a hospital or nursing home setting. And so we're going to talk about using protective equipment in a hospital. I wish someone had shared this with me so I would have known hospital protocol. What will you learn? You will learn a definition of personal protective equipment. We'll use the abbreviation PPE. Certain types of PPE and how to use them safely. Guidelines for putting on and removing PPEs and where to remove them, and then the sequence of removing the PPEs. Personal Protective Equipment, or PPE, as defined by the Occupational Safety and Health Administration, or OSHA, is, and I quote, specialized clothing or equipment worn by an employee for protection against infectious materials. We could modify that particular definition a little bit to simply say specialized clothing or equipment worn by an employee, clergy, or a visitor to protect them against infectious materials. The following is a list of PPEs that are used in a healthcare setting. Not all of these protective pieces of equipment will be used by a minister in a hospital or nursing home setting, but all of them are used in a healthcare setting. Gloves protect the hands. Gowns or aprons protect the skin and or the clothing. Masks and sometimes respirators protect the mouth and nose. Respirators protect respiratory tract from airborne infectious agents. Goggles protect the eyes. Face shields protect the face, mouth, nose, and eyes. All of the PPEs are used to prevent contact with infectious agents or bodily fluids that may contain infectious agents. It creates a barrier between the minister and the infected material. In addition to wearing PPEs, you should also use safe practices in the hospital and the nursing home. Avoid contaminating yourself by keeping your hands away from your face and not touching or adjusting any of the personal protective equipment. Also, remove your gloves if they become torn and wash your hands before putting on a new pair of gloves. You should also avoid spreading contamination by limiting surfaces and items touched with contaminated gloves. Now, here are some guidelines for the use of gloves. Gloves protect you against infectious material. However, when they become contaminated, they become a means for spreading infectious material to yourself, to patients, or to other environmental surfaces. Therefore, the way you use gloves can influence the risk of disease transmission in a hospital or nursing homes. These are the most important do's and don'ts of using gloves. Work from clean to dirty. This is a basic principle of infection control. In this instance, it refers to touching clean body sites or surfaces before you touch dirty or heavily contaminated areas. And then limit opportunities for touch contamination. Protect yourself, others, and environmental surfaces. How many times have you seen someone adjust their glasses, rub their nose, or touch their face with gloves that have been in contact with a patient? This is one example of touch contamination that can potentially expose you to infectious agents. Think about environmental surfaces too, and avoid unnecessary touching them with contaminated gloves. Surfaces such as light switches, door and cabinet knobs can become contaminated if they are touched by soiled gloves. There are 3 factors that influence the type of gown or apron that you will receive when you visit in the hospital. First, the purpose of the use. Isolation gowns are generally the preferred PPE for clothing, but aprons are occasionally used when limited contamination is anticipated. If contamination of the arms can be anticipated, a gown should be selected. The gown should fully cover the torso, fit comfortably over the body, and have long sleeves that fit snugly at the wrist. The second factor is the material. There are three types of material: natural or man-made material, reusable or disposable material, and then those that are resistant to fluid penetration. And then the last factor, clean or sterile. The last factor includes whether the garment just simply needs to be cleaned or if it needs to be sterile. Clean gowns are generally used for isolation. Sterile gowns are only necessary for performing invasive procedures. So you as a minister would not need to be concerned about that type of gown. Again, it is for the safety of the patient and the visitor that these garments are used. Here are some brief guidelines for using face protection. Masks should fully cover the nose and mouth and prevent liquid penetration. Masks should fit snugly over the nose and mouth. For this reason, masks that have a flexible nose piece and can be secured by elastic are preferable. Here are some key points to consider concerning personal protective equipment. First, put on the personal protective equipment before you have contact with the patient, generally before you enter the room. Once you have your PPE on, use it carefully to prevent spreading contamination. When you have completed your visit, remove the PPE carefully and discard it in the receptacles that are provided. Then, immediately wash your hands. Here is a sequence for putting on the personal protective equipment. The gown should always be put on first, followed by the mask. Be sure that the mask is adjusted properly so that it covers your mouth and your nose. And then last, put on the gloves. On the following slides, we will examine how to put on and how to properly take off all three of these pieces of personal protective equipment. In most hospitals, a room of isolation will be indicated by a cart sitting outside the room. You'll see gowns, masks, and other paraphernalia perhaps that will be needed for your protection. Now, how do you put on a gown? First, you select one of the gowns from the cart that you find in front of the room. The opening of the gown should be in the back. Secure the gown at the neck and the waist. If the gown is too small to fully cover your torso, then use two gowns. Put on the first gown with the opening in front and the second gown over the first with the opening in the back. You'll notice the diagram to the right of this slide indicating to you the proper way of putting on a gown. Once the visit is over, you will want to remove the gown properly. Unfasten the gown ties with the ungloved hands. Slip hands underneath the gown at the neck and shoulder. Peel away from the shoulders. Slip the fingers of one hand under the cuff of the opposite arm. Pull the hand into the sleeve, grasping the gown from inside. Reach across and push the sleeve off the opposite arm. Fold the gown towards the inside and fold or roll it into a bundle. Only the clean part of the gown should be visible. Discard this gown in the receptacle outside the patient's room. You'll notice these step-by-step instructions are illustrated on the slide before you. From the illustration, you realize we're going to talk about how to put on a mask. Some masks are fastened with ties, others with elastic. If the mask has ties, place the mask over your mouth, nose, and chin. Fit the flexible nose piece to the bridge of your nose. Tie the upper set at the back of your head and then the lower set at the base of your neck. If a mask has elastic headbands, then separate the two bands. Hold the mask in one hand and the bands in the other. Place and hold the mask over your nose, mouth, and chin, then stretch the bands over your head and secure them comfortably. One band on the upper back of your head, the other band below the ears at the base of your neck. It seems a simple matter to remove a mask, but think about this. The mask is considered contaminated and should not be touched. Remove the mask by handling only the ties or elastic bands, starting with the bottom, then top of the bands. Lift the mask away from the face and discard it in the designated waste receptacle. Here are some guidelines for putting on gloves. It's the last item to put on before you visit the patient. Insert each hand into the appropriate glove and adjust as needed for comfort and dexterity. If you're wearing an isolation gown, tuck the gown cuffs securely under each glove. This provides a continuous barrier of protection for your skin. Now let's talk about how to properly remove gloves. Use one gloved hand. Grasp the outside of the opposite glove near the wrist. Pull and peel the glove away from the hand. The glove should now be turned inside out, with the contaminated side now on the inside. Hold the removed glove in the opposite gloved hand. On the next slide, we will continue reviewing the process for removing gloves. On the previous slide, we talked about using one gloved hand to grasp the inside of the opposite glove near the wrist when we're removing our gloves. Pull and peel the glove away from the hand. The glove should now be turned inside out, with the contaminated side now on the inside. Hold the removed glove in the opposite gloved hand. Now slide one or two fingers of the ungloved hand under the wrist of the remaining glove. Peel glove off from the inside, creating a bag for both gloves. Discard in the waste container. Now, where should you remove the PPE? Well, the location for removing this should certainly be on your mind. If you only use gloves, then it's safe to remove and discard them in the patient's room. But when a gown or a full PPE is worn, then you should remove it at the doorway of the patient's room. What's the sequence for removing PPEs? Well, remove your gloves first, then your gown, then your mask. Be sure that you properly dispose of all of these in the receptacles that are provided in the hospital or the nursing home. Hand washing should be performed after all use of PPEs. Hopefully these moments of instruction will help you stay safe in a germ-filled environment.